Hello, how are you? Dr. Erickson with EHS Physical Therapy Chiropractic, as well as, so on this YouTube, our new channel here, Herniated Disc, exercises, fitness, things to help you if you have a herniated disc, a bulged disc, what are some other protrusions, all kinds of those, those issues, sciatica, pinched nerve, anything having to do with the spine and a disc injury. I want to help you with these issues. So I had someone recently ask a question about some shoulder exercises that they did at physical therapy because they have been diagnosed with a lower neck, so the lower cervical spine, or in this case, kind of the upper thoracic spine. In that area where the neck bones then turn into your mid-back or thoracic bones, that we call that a CT junction, C meaning cervical, T meaning thoracic, where they kind of transition. Very common spot to have a problem. So in that lower neck, C6, C7, you can commonly get shoulder and or like scapular or shoulder blade pain, that vertical pain between the spine and your shoulder blade. There's this pain through here on the backside and then kind of out this way. So why they were more sore? You should not be more sore afterwards, first of all. And so what kind of shoulder exercises should you do? Well, you really shouldn't be doing a lot of shoulder exercises at all because it's not a shoulder problem. I know you feel it there. I know you feel it in the shoulder blade and possibly even down into the arm. But we have to address the space occupier, right? I mean, the piece of tissue, the piece of disc that's taking up space it's not supposed to be in. We got to fix that first and kind of reduce or centralize or move that pain. Then we can start doing some more shoulder exercises for strengthening. So I would start with, in that lower cervical spine, I would start in sitting. I would just kind of get a sense of what kind of motion you have, and it may be where that side, when you move your arm, it does hurt and you feel a loss of motion. But you want to make sure that you sit all the way to the back of the chair, nice and tall. This is not effective if you're sitting slouched like this. You're not going to be able to move the way we need to move. So sit all the way to the back. It's a pretty firm back chair. Get just a brief check of your neck range of motion. So look left. What do you feel? Does it radiate down? Is it just painful on one side? Rotate right. What do you feel? Is it blocked? Is it free? Any sensations? Okay. Head forward. Head backwards. What happens when you go backwards? What happens when you go forward? Does it feel blocky or obstructed? Does it either send pain to another area or increase pain you already have in a shoulder blade or arm? To go back this way or turn this way, does that send things on? Okay? So then start with just moving the lower neck. We know the problem is there. Like I said, this is if you've already had somebody assess it, you've already had your advanced imaging, MRI, you have a disc bulge at this spot. Okay. Start with moving the whole head and neck backwards so that you move these lower, I don't know if you can see that on there pretty good. You see those lower bones move into extension. The upper bones move into flexion. And this may feel like it's a stabbing, ooh, that hurts right through my shoulder blade. Okay, so pressure on, pressure off. Pressure on, pressure off. I'm not pushing really with my fingers. I know it seems like I'm more of just guiding my chin back there. So you can use the web space or two fingers. I'm just doing this to get myself on the correct plane of movement so that I'm not doing this or some weird, it's got to be straight back. I'm going to assess this first, a good 30, 40, 50 reps, not just 5 or 6. We're going to have to assess and see, is it changing? Is it starting to make the shoulder blade pain decreased or at least move more towards the middle? Or the arm pain decrease or at least move more towards the middle? Number 2, is my motion freer? More free? Is it easier to move? Okay? Is it easier to move? If it is, positive. Green light. Keep going. More. And then we're going to start actually adding to go in and then roll back and use the weight of your head to really close down that space. Okay? If it's not, if it's it's still sore or it makes something go further down, stop this one. Okay, don't keep doing that. We're going to have to change, all right? I'll have to make another video for those that are not progressing or not responding correctly or the way that we want to with this one. It's okay if you don't. I mean, there are other things we can do, but the vast majority of you watching will respond positively to that movement, okay? Not on the first rep, maybe not even on the 20th rep, but as long as you're not, too worse overall, keep trying until something definitely changes, where no, I'm overall better or I am overall worse. If I'm overall worse, further down, and worse meaning it moves further down, or you lose motion, you cannot turn as far as you did before, that would be a worsening. Then we got to do something different. We either got to change the angle, or we have to probably lie down, take the weight of your head and gravity away, and do it lying, so I'm on my back, and just kind of go in an unloaded fashion, okay? But like I said, we can make a different video for that and show that differently, Matt, on the unloaded versus loaded. So then I would progress from here to here to here, okay? Way back, and see if that continues to bring it up and feel better in that shoulder blade. Then I'd actually stay with that one for now, for a good couple days. Or if it's very sharp, it's painful and sharp pain, like right, in that area, to let that head tip back, you could kind of support the head a little bit or lower neck down in here and still tuck in and lean back that way and get a little bit more of the upper thoracic spine involved. For some, this may be more beneficial, and you might get even better result by doing it that way. And for others, it may not be as good as just going straight back in there. So we have to start there because we have to address and reduce the problem causing, we call it a derangement, but it's really just a space occupier. It's a piece of that tissue. I said this is for people who have already been diagnosed. They know it's back there. Well, so then picture in your mind you using the weight of your head, movements, and positions to close that space that I want it. This thing is taking up space back here it doesn't belong in. So I want to use some motions to milk it back out of the way and remove it. Move it from the area that it's not supposed to be in. And then, when it does that, the pain responds quickly. It feels better. It's less intense, and it moves more to the middle. It also, your mechanics or the way you move your spine and arm will be less. So after you do those, sets of 10, but you got to get more than a couple in. It takes some movement. It takes some time. Get a good, 40, 50, 60 reps spaced out, but do them. And then, recheck your motion and recheck how that, the arm's moving easier with less pain in my shoulder blade. If that's the case, keep going. I'll keep showing some more videos, or just reach out to me, drop a comment in, ask a question, whatever, however I can be helpful to help you resolve this problem. That's what we want to do. And also, please subscribe to the channel. Send it out. Share it to anybody who's having these kind of problems, either in the upper spine, neck, upper back, shoulder, or lower spine, low back, hip, leg. We're going to cover all these things in this channel. Thanks.